the episode of Vichy Integrative Conversations, the Integrative Skin and Scalp podcast series. My name is Natalia. I'm a dermatologist and the Director of Medical Relations at Vichy Laboratoire. And today we would like to deep dive into the topic of integrative health. Today in this beautiful studio, I have Thorrun Govind joining me for this podcast, who is a pharmacist and a TV speaker about health coming from the UK. So Thorrun, welcome.
Excited to be here. Thank you for having me. Integrative health has become so much more important. We are getting our patients coming in to ask more and more, not just about medicine. So we're going to have a great conversation today.
Absolutely. Indeed, there is an increase in demand of holistic approach and more integrative approach, not only regarding the skin health, but entire body, because after all, it all interlinked together, isn't it?
Exactly. Sleep's a big one for me. We get a lot of patients coming in because they're struggling with their sleep, and height of summer can be very difficult to go to sleep sometimes, but we know that the brain and all those processes that happen when we are asleep, we need to make sure that they do happen really well, and if that is disrupted, that really does impact on our body. And nutrition as well. I'm sure we're going to get into some nutrition bits as well. So I think people are more and more conscious about not just medicines. So, pharmacists traditionally has been about medicines, right?
Yeah, answering the prescription, right? So you ask for this, here's that, but there's much more to advise and to go deeper in more holistic approach, right? And you mentioned the sleep, but it's interesting because now I see that there is more and more publications and the scientific talks about so-called gut-brain-skin axis. So basically it's the interlink between neurology, endocrine system, and also immune system, how it all affects the condition of health in general, and after all, the skin, because skin is the mirror of the health which is happening inside.
Yeah, and in the pharmacy as well, I think there's rows and rows of products, and the value that we offer as pharmacists is to be able to explain the difference between those products and then to explain the evidence behind it. And in a world now where people are accessing this education, it may not be correct on social media. So we need to think about how they're accessing really, important and correct content. And that's why the role of a pharmacist is
shown. Absolutely. And how do you personally apply this integrative, holistic approach towards your patients, especially when it comes to the skin concerns?
So in the UK, I'm in England, and we have our fantastic private consultation room. So I think it's really important to be able to ask patients to go into that private space where it's calm, where they feel that they can relax a little bit, because it can be scary seeing a healthcare professional. And to be able to talk to them, it's not just about a medicine, it's about the other things that are going on in their life. For example, patients may be prescribed something, and that might be because something in their life is really big at that moment. So we also have to think about de-prescribing is quite a big role of the pharmacist as well, and thinking, is this patient meant to be on this medicine? But I've learned a lot from the Vichy, my fellow International Pharmacist Board. And in other countries, if you're prescribed an antibiotic, for example, you might be offered probiotics as well. So I've been learned so much recently, working with the team. And we did a fantastic paper as well, supported by Vichy. So it's just such an exciting time to be a pharmacist.
Absolutely, and it's very interesting what you said about the consultation room. Honestly, I'm afraid that not every country can boast to have such a room in their pharmacies. So I believe that it's the future, because in this kind of private space, you can really have this patient-centric approach, right? Because it can be all around the patient. When you're just facing the patient at the counter, it might be the good moment, not the good environment to go a bit deeper and to go a little bit beyond the prescription.
Exactly, and it's that holistic approach and thinking, what else can we offer to this patient? Because we have that opportunity that they come into the pharmacy. We're open long hours, we are accessible, and I think people get a really fast access to a really highly trained healthcare professional. We need to make sure that that as pharmacists we're up to date. So I think any support that we can have, and there is some training support from you as a team, to be able to access that. So we are supported in our roles, which is changing all the time. And something that really excites me is the red light technology and AI technology. Fascinating.
Yes, indeed. If we can go deeper in a different ways, how we can support the patients on their journey, even without having this room and intimacy to share, right? There's some moment for the diagnostic of the person and to go a little bit beyond the prescription. What can be also interesting is to know how specific recommendations, like medical recommendations, might require additional support. Accidentally, today with Thorrun, we had a talk during the event, the week event, for the pharmacists, where we welcome more than 100 pharmacists that are coming from all over the world. And together with Thorrun, we talked about integrative health and different support that the pharmacists can provide according to different prescriptions. And I liked what you mentioned about minoxidil, for example, that if you know that the cosmeticity of minoxidil can be challenging due to sensitivity, irritation, or even just a texture, the patient might not support the texture of the product, it drastically affects the compliance. And it's crucial to understand, like, okay, if the patient have this or that prescription, how can you advise something more holistic to prevent him from the secondary effects, or else actually substitute it with something that would make sense in order to facilitate having this treatment going through.
And also, it's also about adherence. So you could be supporting that patient to take that treatment in the first place. And, you know, a doctor's appointment, a prescriber's appointment, that costs time and money. And we want to make sure that if the patient chooses not to take the medication, we need to understand why. What are the barriers to them using that medication? So this is all part of the pharmacist's evolving role. I think we've had some fantastic conversations with pharmacists across the globe today, and to have so many pharmacists in one room and to bounce ideas off each other and also learn about the latest news from Vichy, and we're top secret, so we can't talk about that just yet, but to be able to learn and find out more about what Vichy is doing behind the scenes really supports our practice when we go back to our own countries and take all this learning back with us.
Absolutely. And if you could highlight one message that we were talking about integrative health today on stage, what would it be? What you would like to deliver to our audience and to other pharmacists? Like, keep a message home.
So I would just ask you to take one small step each day towards integrative health and supporting your patients. So that could be offering one bit of lifestyle advice, one bit of adjunct therapy advice to your patients every single day. It all adds up, and we are all ambassadors for the pharmacy profession across the globe and really showcasing our value as experienced clinicians.
Thorrun, and one more question for you. If you could give one piece of advice for your colleagues, for the pharmacists across the globe, what would it be?
My one bit of advice to pharmacists is to really own your role. You're an experienced healthcare professional in your local community. So one small change every day, whether that be in a conversation, asking about sleep, asking about nutrition, asking about red light therapy. I think more and more now, I know younger people coming into the pharmacy are really up to date and in tune with these things. You can also learn from them. So I also think it's a partnership with patients when it comes to integrative health.
Absolutely. And I actually agree with you that pharmacists have a crucial role, because unfortunately the reality of the world today is that some patients cannot get to the doctors because of the money issue, insurance issue, or just accessibility.
Yeah.
Whether it's a territory that the doctors cabinets are just too far, in another village, in another town, or because the insurance is not covering them. So quite often the pharmacists play a crucial role, and of advisor, and the one who makes the diagnostic, and the one who gives the prescription after all. So indeed, educating the pharmacist and bringing this holistic approach to the pharmaceutical audience is the keys to success.
Absolutely. And my advice to patients as well would be,
again, think about your body is a bit like a car, isn't it? You don't just fix one part of the car. You also need to think about the smooth running of the car as well. So you also need to think about, you know, your exercise, your sleep, your diet. All of these things can impact how medicines work, but also may change your prescription or may impact how you need medicines. And what we're not saying don't have medicines. What we're saying is get yourself in the best position possible. You know, think about all these other things that we can do to stay well. And I really, really care about self-care. Is a really big thing to me, trying to encourage people to self-care. And preventative health, this is it, isn't it?
That's it. Yeah.
We want people to be enjoying their life for longer, but also being able to make the most of life.
Great. Yeah, that's a very important piece of advice. Thank you, Thorrun. And if you would like to learn more about the different contents and the different episodes that we created for the Pharmacist, focusing on longevity, sun exposure, dandruffs, etc., please stay tuned and follow the next episodes.